Last month, a 20-year-old engineering student came to us and said, "Doctor, my vision is becoming blurrier every month and my spectacle numbers are changing very frequently." After running few tests, we found that he had a disorder called as keratoconus. Keratoconus is when the front part of your eye, which is the focusing lens called as cornea, starts to become thinner and starts to bulge out, thus not being able to focus the images very well. The good news is that with advanced treatments, we were not only able to stabilize his disorder but also restore back his functional vision. And in this educational video, I am going to take you through what is keratoconus, why it happens, how to diagnose it, and what are the current management protocols and the latest treatments available around the world and especially at Asian Eye Hospital. First, let us understand how a normal eye works. Consider your eyes to be a high definition camera in which there is a lens which is perfectly shaped and perfectly focused that focuses the image on the sensor of the camera. Your eye works exactly like that, where the focusing lens is nothing but your front clear dome-shaped organ which is called as cornea. If this biological lens loses its shape and its focus, the biological camera, that is our eyes, loses its focus and creates distorted images. And this is exactly what happens in keratoconus. So keratoconus is a progressive eye condition in which your cornea, which is perfectly round shaped, starts to become thin, starts to bulge out and being shaped like a cone. When this occurs, the cornea is not able to focus the images on the retina very well, leading to distorted vision, shadowing in the letters, glare and halo phenomenons in the night around the lights, and frequent change in spectacle numbers because constant progressive change in cornea. It starts in teenage years or in early 20s and may progress over time, sometimes slowly but sometimes quickly. But unfortunately, the tricky part is many of these patients mistake it for just change or increase in eye powers and just keep changing glasses when the real reason lies in the weak cornea. We don't yet know what exactly causes keratoconus, but we certainly know what increases the risk. First is genetics. If someone in your family, especially your siblings or your parents, have keratoconus, that is known to increase your risk of developing keratoconus by 20%. The second, which is well proven, is a bad habit of constant eye rubbing, which is known to break your collagen fibers in the cornea and starts cornea to bulge out, developing into rapidly progressive keratoconus. Third is allergies and atopy. Like allergies, asthma and eczema are strongly linked with keratoconus. And the fourth one is hormonal changes, and that's why the keratoconus is known to suddenly start progressing during pregnancy or during puberty. But sometimes it can occur without any apparent cause. That's why screening the apparently at-risk individuals is very important. The mainstay of focus should be on early detection because the treatment works the best when the disease is caught early in its condition. The basic diagnostic screening tool is called as corneal topography, which creates a color-coded map of corneal shape. But now we have even more advanced and more sensitive screening diagnostic tools, which are called as corneal tomography, which is more sensitive in detecting keratoconus early on. The best example of corneal tomography is the pentacam scan. It is non-invasive 2-minute diagnostic scan of your cornea which can detect keratoconus even before it becomes clinically apparent. We recommend having screening with pentacam scans to detect keratoconus in patients who have either frequently changing glass prescriptions or who are not happy with the quality of their vision which is deteriorating over time, or with prescriptions which involves high cylindrical spectacle numbers more than 1.5 diopters. The good news is that most of these patients, we can stabilize the keratoconus today, and in many of them, we can restore back functional vision. The treatment protocol will depend on the stage of diagnosis of keratoconus. The treatment is divided into two different targets. Number one is stabilizing keratoconus, and number two is restoring vision. The first and the most important step is to stop keratoconus from getting worse, and that is where comes the role of corneal collagen cross-linking. The corneal collagen cross-linkage work with the combination of vitamin B2 drops, which are called as riboflavin. So your cornea is first impregnated with these drops for about 20 minutes, and this is followed by exposure of the UVA light, which is used in controlled fashion. The combination of riboflavin and the UVA light creates a chemical reaction in the cornea, thus stiffening the cornea. You can consider this to be similar to toughening a glass. This stiffened cornea is resistant to further changes in its shape and thus leads to a stabilized keratoconus. The latest advancement in corneal collagen cross-linking technology is called as the Keratan protocol. While in standard collagen cross-linkage procedure, the first step involves removal of the epithelium, which is skin over the cornea, with the help of a blade or alcohol, which is then followed by the UVA light exposure. As against that, in the Keratan protocol, both the steps are done by laser without using any kind of blade. The first step is done by excimer laser, which is very precise, that uses the mode called as the PTK to remove the epithelium over the cornea, and that is then followed by what is called as the latest generation of accelerated cross-linkage, which has made this treatment more successful, with more number of people getting stabilized more successfully, with faster recovery and much better outcomes over time. The Keratan protocol has been innovated by my mentor, Professor George Quinones, who is regarded as possibly the most important legend in keratoconus management in the world today. We have conducted series of researches comparing the Keratan protocol with the currently standard cross-linking treatments such as C3R or CXL, and we have proven and published our research in prestigious journals to showcase that the Keratan protocol gave clinically and statistically significantly better outcomes for our series of patients than those undergoing standard cross-linkage. There are some other advanced protocols for cross-linking treatment, which are called as Athens protocol, which is a combination of a topo-guided PRK with collagen cross-linkage. Hafez's protocol, which is especially for advanced keratoconus, where very thin cornea can also be treated successfully to stabilize them, and the SMILE lenticule-assisted protocols for those people where the standard cross-linking cannot be performed. At Asian Eye Hospital, we have pioneered many of these several formulas in our country and have treated several thousands of patients successfully. The second important objective of keratoconus treatment is to give back functional vision to our patients. So it depends on the stage of keratoconus how that treatment will be targeted. For patients who have a very mild keratoconus, their vision is still excellent with their glasses and they can continue with them. However, for patients who have moderate or more than moderate keratoconus, their vision is distorted and cannot be restored back by use of glasses. And in them comes the role of specialized keratoconus contact lenses. The specialized contact lenses work on the principle of masking keratoconus irregularities. There are chiefly of two kinds. One is called as the RGP or the Rose K contact lenses, They are small contact lenses, they sit on the front portion of the cornea and they give a very good quality of vision. However, they are known to cause more irritation and irritability to the eyes. The best quality of these contact lenses are the scleral contact lenses, which are much bigger and they have a clear fluid between the contact lens and the distorted corneas, thus giving not only the best of vision but also the best of comfort. We have created a short video on the same topic and I'm going to put a link to that in the description. And the last and very important advancement in management of keratoconus is freedom from spectacle even in keratoconic patients with the help of specialized contact lenses that are implanted inside your eye. They are called as ICL procedures. So ICLs are currently the only way to get freedom from glasses in patients who have mild keratoconus. These are thin rollable biolenses which are implanted inside your eye with a very small 2 mm incision in a painless 5-minute quick procedure. But they are possible only in those people who have early keratoconus and still have excellent vision with their glasses. But in those eyes who don't get diagnosis early, who present very late in advanced keratoconus stages, where the corneas become so thin that collagen cross-linking is simply not possible, or the cornea becomes scarred. In these cases, the best modality of treatment and the last resort is corneal transplant procedure. The corneal transplant simply means that your diseased cornea will be replaced with a healthy donor cornea, and with that you can restore back your vision to a great extent. There are many advancements also in corneal transplant with keratoconus, and they are called as component corneal transplant. Component corneal transplants are advancements in which we don't have to replace your full thickness of corneal tissue but only that portion of the cornea which is diseased. But remember that early diagnosis can make your treatment easy and give you a very good, fulfilling vision throughout your lifetime. So my friends, keratoconus can sound scary, but with early detection and modern treatments, it is very easy now to stop the disease from progressing and restore back your vision. At Asian Eye Hospital, we have been pioneering keratoconus treatment for more than 20-25 years, and we have so far treated more than 5,000 keratoconus patients of varied degree of severity. We have all these modalities available under one roof, and we are one of the premier centers of keratoconus research and advancements recognized globally. So this is Dr. Vardhaman Kankaria signing off, and if you have found this video useful, please like, share and subscribe for such educational videos for the future.